The procedure of dermal fillers is fairly simple. The vials come in 1 ml sizes, and Restylane, for instance, has fillers like Restylane, like Perlane. Juvederm has Juvederm Bolif, Juvederm Voluma. So we choose the specific filler for the specific area we want to treat. We have thicker fillers, we have thinner fillers. It's a tiny, tiny needle, and after cleaning the face, we target the area we want to treat, and we gently and slowly inject through a thin needle the filler into the area we want to treat. The treatment literally lasts 5 to 10 minutes, and as we're injecting, and I like to inject small boluses, carefully, slowly. We don't very often use the cannula, because using the needle, we can be very specific in how and where we place that filler. As we place it, we also mold it. It's a beautiful product which we can mold in the right way that we want to mold it. And at the end of the procedure, we stop any bleeding that there might be, and the patient can actually put mineral makeup on straight after the procedure and go back to work.